Nurses are with people during the most vulnerable times of their lives. During those times, any small act of kindness, competence, are so valued by patients, so treasured by patients and their families to help them get through those struggles.
If you say you were a graduate in nursing from Indiana University, they will know that you're connected with excellence and cutting-edge scholarship.
We love the vision that comes from that school and the talent that you see from the nursing students who graduate.
Nurses are the heartbeat of healthcare. You know, there's someone out there that, that needs me. There's someone out there whose health is in jeopardy. It's someone's life I can save. I feel like that's my, my purpose, my calling in life, and, I just want to fulfill it.
One of the things that I kept hearing about over and over again when I read the oral histories of the men and women who were responsible for the last 25 years of the school's history was it was all about the Hoosier spirit. And I kept coming back to this idea of the community of men and women who joined together with this idea that Indiana and nursing were meant to be together and were meant to change the world together. What began as the Indiana University Training School for Nursing in 1914 was renamed the Indiana University School of Nursing in 1956. Its first leaders were directors, but from 1956 on, these directors would now be deans with a powerful voice in university policy and in the discipline.
One of the things that I know that they have worked toward trying to embrace, all students, not just the majority students, but the minority students as well. In 1953, Ann Mitchum Davis became the first black student to graduate from the Indiana University Training School for Nurses. The school's first black faculty member, LaRon Sams, went on to help found the National Black Nurses Association.
It's been harder to integrate men into the profession, but in 1967, John Foster was the first man to graduate from the school, and the Indiana University American Assembly of Men in Nursing was established in 2011 and is the only chapter in the state of Indiana. One thing that particularly impressed me reading the history of the Indiana School of Nursing was its commitment to innovation.
So you can be innovative, but if you're not bold, innovation goes nowhere. So it's the boldness of the leaders, the faculty and staff that help create opportunities for our students to learn and to grow.
Well, the impact of the innovations that we've done here has improved learning for the students. Well, I think the school has received lots of recognition for our work in the area of excellence of teaching and learning. One thing that we're really proud of is our designation as a Center of Excellence from the National League for Nursing.
We have some amazingly creative faculty and staff and that really make that learning very meaningful and allow students from way beyond Indiana to access our expert faculty.
The real benefit of using distance technology is that we can offer the courses to the students in their own community, and this has made a big impact throughout the state. We haven't lost our great students. They've been able to stay on and provide leadership to the state.
I feel like what it means to be an IU nurse is just to go above and beyond what someone would expect from your average, typical nurse. Someone that just wakes up, goes in, does their job. They're just the epitome of what a great nursing program is supposed to be. And nurses build a special relationship with their patients, and it's about having their best interests at heart and really giving patient-centered care.
Community service has been something that IU School of Nursing has done from day one. And the roots of that community service go all the way back to actually the profession of nursing in the United States.
As a member of this community, I think the IU School of Nursing resonates in terms of its commitment to community service.
Indiana faced an acute shortage of healthcare providers, particularly in rural areas, and the School of Nursing stepped up to try to meet that need. We were one of the first schools to get funding for nurse practitioner programs as well as for clinical nurse specialist programs, and we've continued to be a leader.
The IU School of Nursing defines in many ways what nursing is. We are a national leader in understanding health outcomes, and partnerships give us an opportunity to realize that mission and to work with others to not only promote the work we do here in the school, but to change human health. What really distinguishes our partnership and our ability to partner is that we're generating knowledge. So when we're working with patients, we're working with clients, we're working in communities, we're actually generating new knowledge that I know will transform health in the United States.
From its earliest days, the Indiana University School of Nursing has recruited outstanding and well-educated nurses to lead and seek answers to critical questions surrounding nursing practice, the very bedrock of a research mission.
In 1922, 6 IU student nurses met in a dorm room and worked out a plan they hoped could advance the status of nursing as a profession. There has always been some notion that nursing was more workforce development rather than knowledge working. And they had the notion of nurses as knowledge workers, which I have to say for 21st century nursing is exactly what nursing is at this point, knowledge work.
We are the envy, and I mean the envy of schools here at IUPUI in terms of having a infrastructure for support for research.
We're a leader in the nation in terms of research funding, and we also have this really incredible portfolio that crosses both nursing education and clinical sciences.
The School of Nursing is the natural home for the type of research we do. We have basic scientists who do bench research, lab research, clinical scientists who do drug research. The research that touches people, the behavioral research, population research is done within the School of Nursing primarily here.
And with the development of a doctoral program, the school really began to shift
to train nurses to apply nursing knowledge at the bedside and to change systems of healthcare delivery. From its founding in 1914, it was always committed to producing leaders in the discipline of nursing, leaders at the bedside, leaders in the community, leaders across the globe.
I hadn't really thought a lot about the IU School of Nursing until I received a recruitment letter, and then that sort of jogged my memory that one of the people that I worked with for quite some time in Kenya was part of the AMPATH program here at IU. And I just remembered that that program was very highly regarded within Kenya, the communities.
Well, the IU School of Nursing has a very rich international involvement. We are living in a global society. It's really important that our students understand what's going on internationally, and we can learn from many other countries in terms of nursing care. IU nurses are leaders. They exude confidence and competence, and they're about serving their fellow man.
I hereby pledge before this assembly as a member of the Indiana University School of Nursing to uphold its core values of respect, responsibility, trust, and dialogue.
An IU nurse has a legacy of leadership. They are lifelong learners, and they are committed to making a difference in the lives of people and in their communities.
And our history gives us unique context to provide leadership into the future.
Anytime you interact with a Indiana University School of Nursing, it just only takes you a few minutes to recognize the type of talent and skill set that we attract.
Nurses at Indiana have always been asking and answering questions. I think that's one of the hallmark characteristics of what made the Indiana University School of Nursing so great.
It isn't that we've been around for 100 years, it's that for 100 years we've been changing the health of humans all over the world. That is an extraordinary achievement, and we're going to do it for another 100.
I will embrace diversity and be impartial, and devote myself to continuously advocate for the safety and welfare of those committed to my care. To the best of my ability, I will serve in my practice with distinction.